Hello again, Dr. Scott Carlson, here to recap some of the things we talked about with this new frontier in dry eye disease by using the FDA-approved OptiLite IPL. Dry eye disease, we have a lengthy definition put together by the Tear Film Society. There's a lot of factors that contribute to dry eye disease, which is coming from the surface inflammation. Dry eye disease is chronic, meaning it's long-standing, and it's progressive, so it gets worse over time. With the symptoms being painful, red, gritty, itchy, burning, stinging, watery eyes, with fluctuating vision. Its progressive nature makes it more and more frustrating as we get old. So we know that a majority of the dry eye disease comes from these meibomian glands. So it's called meibomian gland dysfunction. They're oil glands. When you blink, it picks up the oil along the lid margin, smooth over the eye so your tears don't evaporate. In mild cases, we treat the lower lids, cheek to cheek over the nose, 4 passes with the OptiLite. Those are the FDA protocols. In our moderate, more advanced cases, we're also treating the upper lids as well. As I mentioned, meibomian glands, we're looking at over 85% of dry eye disease is due to meibomian gland dysfunction. So we've got an FDA-approved device that treats a multifactorial disease at each of these levels. If the unstable tear film, ocular surface inflammation, which causes the abnormal blood vessels, causing inflammation in the eyelids, which contributes to those meibomian glands and the bacterial load that occurs with them. So we're able to treat each of those. This is a great example. The leaky blood vessels, the inflammation, these are the inflammatory markers that are actually measured. And this would be like an after treatment where the inflammation goes down and these eyelids, the glands are able to do their job more effectively. So the tissue is really thin. So we need a device that's extremely precise. So with the OptiLite, we're able to target specific levels and specific chromophores, which are the colors that are found in the skin, to help seal up those leaky vessels. We kind of get back to work. We had a nurse yesterday, after her treatment, went straight back to the hospital. There's very little downtime. Your skin might feel a little tingly, like you've been at the pool all day. And it does detoxify the skin. So the leaky vessels tend to fade. Some of your age spots will fade. The skin brightens up. Patients love it. Glands start releasing the oils, you may have occasional stinging. That will fade with the 4th treatment. So we're looking at 4 treatments according to FDA protocols over 2 to 4 weeks. We're talking about how to express the glands that are in your eyelids. This is the #1 cause of dry eye disease. And when you blink, what happens is your eyelids come down and touch, and it picks up the oil that comes to the surface of the lids. And so how we do that is we use a Brooder mask, because we've got to apply heat to help get that oil to loosen up. You follow the instructions, put it in the microwave, you rest it on the eyes for 10 minutes, and then after 10 minutes, your lids are warm enough to where you use your index finger, you anchor on the bone below the lid, and then you just milk the glands upwards. Come over the top, anchor the bone above the lid, milk it downwards. You don't want to push on the eye because we don't want to hurt the eye. So this works good with mild. Moderate, severe, we need to use the OptiLite, which is the most effective way to decrease dry eye disease. Any questions, check us out at advantageeye.com. Thanks.